Hello, here we are today with Edmond Haronian of Edmond Haronian Insurance and Financial Services. Edmond, you've been receiving a lot of calls and also emails. Obviously, the bill has passed, the healthcare reform,
Yes.
and there's a lot of changes that have come about. And you suggested that you wanted to do a video to try to explain and go over some of the items and to let people know about the immediate changes, some changes that are going to happen within the 6-month period of time, and some longer term changes. Just take it from here and please let us know what's coming about.
Yeah, the changes would come, it is coming and it will affect all of us. Some aspects of the bill will be implemented immediately, some of them within 6 months, a year, 4 years, and maybe 10 years from now. So what I like to do basically go through them and explain very briefly how they work, and our clients or people who will be viewing this clip can obviously contact us and inquire about their coverages and know exactly how it will affect them. So basically the first effect of the bill would be to encourage the small businesses, small groups, which we call them usually under 20 or under 50 employees, and federal government will be providing a tax credit, so they will encourage them to insure their employees. And effective for the year 2010, every employer will get up to 35% tax credit for providing group health insurance for their employees. This amount will eventually go to 50% in the beginning of 2014. Also, another change that we will notice immediately is that individuals who are currently covered under Medicare Part D for their medications, they do have what's so-called a donut hole. So usually after a certain amount, which is about $1,700 or $1,800, they are on their own for their medication costs. The government will give them $250, people who are getting into that donut hole. Eventually, by year 2020, which is about 10 years from now, that donut hole will be closed. After these steps, we are going to go to...
Is that the extent of the immediate effects?
That is an immediate effect that people will recognize, correct.
Okay, is there anything else that's going to happen quickly?
Not immediately. Within 6 months from the time that the bill did go through.
About January of 2011.
Previous to that, we are looking at September or October. We are looking at scenario what is called the end of recession. Recession. That's
okay.
Sorry. So what basically the insurance companies use to practice that if we get a coverage for an individual and they figured out somebody maybe misrepresented in the application or somebody was sick, they could cancel their policy, and that's the end of it. So when somebody
is that something that's like a pre-existing condition situation?
That's
or
not called a pre-existing condition.
Or like a fraudulent thing?
Probably fraudulent, or maybe somebody forgot to disclose any information, or they did not disclose any information. Insurance company used to be able to cancel their policies, and that practice will stop. The other big effect of this bill, which I personally appreciated more than anything else, 6 months from perhaps now, children will be able to get coverage without any pre-existing condition issue. If a child is sick, by child we mean children under age 19, they will be able to get coverage without any questions, and that's a big effect.
That sounds
Also within 6 months there would be a ban on lifetime limits on coverage. That's one of the most insignificant changes, because usually coverages, they go up to 5, 6, 7 million, and we rarely come across any person that goes to that unless you're seriously sick, and even that doesn't happen. So that would be also eliminated. So there won't be any limits on the coverage. Saying that, that's within 6 months. Now, January 1st, 2011, that's our next step that we're walking to. And
what changes do you anticipate
We will have a couple of changes that is coming at that point, and preventive care would be much more. That would be one of the effects of this bill. Preventive care has to be offered to each individual and their plan without having them to meet any deductibles on the plan. So usually, if any plans you had to meet a deductible, that will not exist anymore, and any individual will be able to visit the doctors without having to meet their deductible. Another big effect that is coming January 1st, 2011, every insurance company will have to spend at least 80% of the revenues that coming to them for medical expenses. We'll see how this will affect. Maybe that will reduce the cost of health insurance, may not, we don't know.
I just wanted to remind the listeners that this is a non-partisan and non-political discussion. You know, what you're saying is really just from the point of view and your understanding as an agent trying to serve your clients, and by no means this is political or partisan.
That's definitely correct. If we will get two sides of views about the healthcare reform, depending who you discuss this with.
Right.
And somebody will tell you this will be positive or negative. So
a lot of it will have to be seen, and time will really show, some of this stuff that is working and not working. But in the meantime, at least we're going into it with good intentions and good outlook.
Exactly. That's correct.
Okay, so what's next?
Next, the middle point or majority of the big changes or the main aspect of this bill will be implemented in 2014. And that's the time that all the individuals, every individual will be mandated to cover themselves by the health insurance, or they will be penalized on their tax returns. So by 2014, every individual has to get health insurance or they will be penalized. All the groups over 50 employees, they will be mandated to get coverage for their health insurance. To me, this is the most significant part of this bill, because success of this plan would be dictated by how many people will go into the pool. If we have a lot of people signing up, then the cost of medicine perhaps will curve down, cost of health insurance. If many people decide not to, then we perhaps will experience a very high rate increase in the health insurance. So that would be the main point of this healthcare reform.
And I don't know this, but perhaps maybe the penalties that there will be assessed could sort of go into covering some of those costs, and maybe it'll dampen the increase.
That's something we'll see. The penalties are not really big at this time. That was one of the biggest arguments in the bill, that people will decide just to step aside, pay the small penalty, and when they get sick, they will decide to come in and get their health insurance coverage. And that's something
because the market will show itself.
That's correct. The change is good. Whether it's going to work or not, that's something that we have to wait and see. We are informing ourselves every day, every week, every month, and we basically here to serve our clients and be there for them with all the changes. And we are committing ourselves to keep up with it and help our clients to be always one step ahead of the game.
That sounds really good. Is there anything else that needs to be said at this time, or?
Well, we are hoping for the success of program. There is a lot of small details of this 2,400 pages of bill, but we don't have time to get into it. So we try to pinpoint the major changes or major points of it, and we are always available to help our clients.
Fantastic. So as always, we encourage the clients to call your office, and if they have any questions, any concerns, you're here to help them, serve them best as you can, and really appreciate it. Thank you so much, Edmond.
Thank you. Thank you, Amin.